So I wanted to start off by introducing myself. As you said, my name is Amber Michael. I'm a prostate cancer nurse navigator with the Christ Hospital Oncology. This is kind of out of my comfort zone, presenting, but I'm thankful to have this opportunity and to join the group. I am married with 3 kids. I have a 16-year-old daughter, a 12-year-old son, and a chocolate lab named Buckeye. He's a big baby. I've been a nurse for 22 years. My career in nursing started at a smaller hospital closer to home, gradually moving to the city, the big city for me, here at Christ. I've loved every opportunity that I've been given as a nurse. My journey has really been that. It's been opportunities and room for growth and learning something new. I've worked anything in IV therapy, outpatient procedures, endoscopy, intensive care. And then I transitioned to Christ about 7 years ago in the pelvic floor center, something I didn't even know existed. So we did a lot of outpatient procedures with urology and other specialists as well. I've always assisted with prostate biopsies, but never been on the side of follow-up or the diagnosis of prostate cancer. So when I was approached about navigation, a little bit hesitant because I didn't even know navigators existed, didn't even know that was a position. But then once I took the position, started talking to others about my new career change, so many people told me I wish I would have had a navigator for my dad or my husband. So and soon enough, I found how important navigation and useful it can be for patients. So 4 years later, I've been a prostate navigator for 4 years now. And again, so thankful to serve the patients and act as a resource and support person for each patient that I interact with as they go through their journey. As part of this series, as you mentioned, you've heard from one of our urologists, Dr. Cox, radiation oncology, Dr. Freeze, and of course, medical oncology, Dr. Mannion. So tonight, part of the end of the series, I want to focus more on supportive services that are available to our prostate cancer patients. Of course, these aren't all inclusive, but they're either services that we provide or most likely other institutions provide as well, or resources that we've used. One of the important things, not every patient knows that these resources even exist. So, hopefully at the end of this, learning something new, maybe I'll learn something, resources that you guys have used. And then, hopefully you can ask for them no matter where you're treated. Okay. Okay, can you guys see that okay?
Yep, we're good. We see it.
All right. So with treating any cancer, it really does, it really takes a multidisciplinary team approach and a lot of collaboration. Physicians, nurses, supportive services, I think sometimes patients are hesitant to ask for help. Maybe they don't know that there are services or, maybe they don't even need them. But just bringing awareness to our patients to, let them know what is available. So specialized treatment teams, you have your urologist, which is Dr. Cox. He talked about surgery and surveillance. Having your prostate removed or active surveillance where you closely monitor your cancer and with hopes to not have to treat it, but if you do have to, you treat it early. Radiation oncologists, so there's different radiation modalities or options, and then you have medical oncologists such as Dr. Mannion when there's medications that are needed when the cancer usually is outside of the prostate. But each of our teams usually consists of a physician. They may have a nurse practitioner or advanced practice provider, a nurse, and a medical assistant. Prostate cancer nurse navigator. So a lot of institutions have site-specific navigators. So I only work with prostate cancer. No, I don't take care of bladder or any other GU cancers. So I meet the patient when they're newly diagnosed. So once they're seen by urology, they refer them to me, let them know that, you know, you're going to be getting a call from a navigator. So I'm with patients from diagnosis through treatment, or even surveillance and into survivorship or palliative care. A big part of my role is I assess for barriers to care throughout their entire journey, things that may keep them from getting the treatment or care that they need. Maybe it's physical, financial, transportation. You know, it could be support. You know, it could be they have children at home that they don't have help with taking care of, or, you know, they don't have family. Spiritual, emotional concerns, cultural preferences, communication concerns, caregiver strains. So pretty much anything that may keep patients from pursuing treatment. I help connect patients to the hospital and community resources as needed, and then making those appropriate referrals depending on that need. I help advocate for patients, and then I work very closely with urology, radiation oncology, and medical oncology. So, and the supportive services teams to help coordinate patient care. I do tell patients you may never, you know, need my services, but I am here. It is nice to pick up the phone and contact one person, you know, without being transferred or a go-to person. I help assess understanding. So after they've had their cancer discussion, I'm talking with the patient, making sure they feel well informed, helping to answer questions, or if there's something that I'm not able to answer or outside of my scope, then I'm always reaching out to the office, to the provider. Maybe the patient maybe needs a follow-up appointment to further discuss their treatment or their diagnosis. I also assist with second opinions, both internal and external. So internal, maybe they want to meet with a radiation oncologist before deciding between surgery or radiation. And then patients that call in, depending on where they are in their journey, then I help schedule that second opinion for them. And then also assist with scheduling appointments for tests and procedures as needed. So as I say, I'm a go-to person for patients. Something that we give out as navigators that just introduces our role, and again, how we can be helpful for patients, that this is given when they have their cancer discussion along with other resources. A new and ongoing patient resources. So cancer support community, the support group and education group. I mention that quite often, especially for patients who maybe they don't have a family history of prostate cancer. They don't know of anybody with prostate cancer that they've been able to talk to. I think talking with others is huge. Even though everybody's experiences are different, it is nice to have that support from other people. Second opinions, open to options is something I mention a lot, just for patients to help, you know, formulate a list of questions if they are going for second opinions. The monthly programs and events, you know, patients that are, maybe they go to senior citizens or different programs in the community. I always like to mention the things that the cancer support community has. It's quite a bit. Cancer Family Care, there's the Cancer Family Care Treehouse, Children's Services, maybe children who are younger that maybe for the patient, it's hard to tell their kids that they have cancer, or maybe the kids will need extra support as well. Zero prostate cancer is pretty known. The NCCN guidelines are National Comprehensive Cancer, which is what our physicians, the guidelines they use for treating patients. Other groups that I've come across just as I've maybe watched other webinars or I've read something somewhere. The male care online support groups are more, I guess, individualized. So there's for caregivers, some of the side effects such as erectile dysfunction and even gay men. There's a group for them. There's cancer care online support, a patient resource, National Cancer Institute, American Cancer Society. They have a 24/7 hotline that I know you can call if you have questions or need someone to talk to. The Prostate Cancer Research Institute, Prostate Cancer Foundation, they have a really nice patient guide. You can either have it mailed to you, the book, or download it for free. They're both free, but download it online. So that's that's a pretty good guide for patients. And then access to incontinence supplies and vacuum erectile device supplies. Something that I've worked with different companies trying to get coupons or discounts for patients because most insurances do not provide assistance for those supplies. So we have social work. Social work I work with them quite often. And I talk to them a lot about my patients when I need, help. I sometimes will go into an appointment together, because patients get very comfortable, they're used to me. So I went into appointments with patients, but they are trained, licensed professionals, and they help patients and their loved ones, the same thing through their entire journey. So counseling and coping, helping with, it could be for themselves, family, children, substance abuse, finding those supportive resources in the community and hospital, access to medications. Some drugs are quite expensive. We have a gentleman here in pharmacy that he helps find programs and assistance as well. Home care needs, medical equipment, financial disability such as short-term disability, FMLA. Transportation is pretty big, housing and skilled nursing placement or end-of-life care needs in hospice. They do routine distress screening. We have certain intervals that we assess for distress, and depending on the score, it goes directly to the social work team. So we have routine timing that we give that out, and then of course as needed. Social work referrals and interventions. Again, transportation is huge. So always looking at the patient's insurance. I think a lot of people don't realize that insurances do provide transportation services. So they can help set that up. They can help coordinate. There's the Council on Aging, American Cancer Society, and the LIFT program. Financial and insurance. So we, of course, have our hospital financial advocates, counseling, patient estimates. There's community resources, navigation of insurance, assisting with applying for Medicaid. Of course, there's specific cancer foundations as well, and food banks. Emotional, as I mentioned, cancer support community, cancer family care, our social workers. Zero Prostate, they have a mentor program, and then Ironman Angels as well. It's more one-on-one support for patients that may not be comfortable in a group setting. The 24/7 hotline, also suicide, elder abuse, and substance abuse assessments. A spiritual, we have our palliative care, pastoral services, and then even our local churches that we can refer to. Sometimes patients just love to have someone from pastoral services just to call and talk to them or pray with them. Medication, so GoodRx, St. Vincent de Paul. We have our pharmacy department, medical or medication vouchers, Medicaid, Medicare, and insurances. Use this with housing, rental assistance, subsidized housing resources, community resources such as house supplies, homeless shelter placement, utility assistance, legal aid, those types of things. Employment, again, assistance with disability, navigation, Social Security, FMLA, and Medicaid leave, medical leave. And then locating or applying for employment. Family support, several that I've already mentioned. But again, I reach out to social work for a lot of things. If I have questions or need help finding something, whether it's in the hospital or community, they're usually my go-to. Medical decision, advanced directives, home health care referrals, survivorship, oxygen and medical equipment, hospice chaplain, and palliative care referrals. Something new to our program is case management. So we have a nurse, so patients that are admitted in the hospital, it helps with follow-up. It's outpatient oncology case manager. So just that transition from a hospital admission or hospital discharge, just to assess their status, their instructions, coordinating services if needed, such as home care, or medical equipment such as oxygen, maybe it's walker or cane, those types of things. They as well collaborate with social work and dietitians. They confirm follow-up with appropriate providers, making sure they have follow-up with oncology, primary care, or whatever their specialty that's needed. And then they continue follow-up for at least 30 days after they're discharged and as needed. They also, they go daily, they go to the interdisciplinary rounds on our oncology unit as well. Financial advocacy. So this is another that's used quite often. So helping to understand what your benefits are, managing cost of medications or bills, finding financial support, applying for copay or assistance programs. A lot of times, talking to patients, I usually offer, if anything, let's see if you do qualify for any assistance. Maybe it's even a payment plan, which several are not even aware that it's an option. So I always at least put the referral and just to help with navigating some of the cost of medical bills. They can also provide estimates on upcoming visits, procedures, treatments, hospital and physician bills, and then, as I mentioned, payment plans. Nutrition services. So we have a great registered dietitian group. They're registered dietitians who are, they can meet with patients in person, or they set up appointments, schedule appointments. They can help with diet plan and managing issues that come along with, any kind of cancer treatment, how to eat for well-being, to be healthier during cancer survivorship or after treatment. You know, how to eat with the side effects such as maybe diarrhea, constipation, nausea, vomiting. I get a lot of patients that ask, now I have this diagnosis, what can I do better in my diet? So I quite often will refer them to nutrition services, and they even help with meal planning as well. Support and management of nutrition before, during, and after treatment. As I mentioned, meal planning, maybe it's eating on a budget, managing diet with chronic diseases, so diabetes, those types of things. A lot of patients, they could be on a steroid in addition to their medication, so they can help with diet changes as well. Weight changes, it's not always weight loss. It could be maybe they want to get their weight under control, lose some weight, physical fitness, digestive problems, nutrition and aging. Sometimes I tell patients I would at least meet with them once. Maybe they're already doing a protein shake, but maybe they need to be drinking something different, or they recommend something else with more protein. And I leave it up to the experts. We have classes that focus on wellness and optimizing nutrition. We have what's called Wellness University, which is pretty neat. They have different sessions. I know they do a lot of cooking demonstrations, talking about supplements and those types of things. So rehab services, a lot of patients, we have a program for our patients having their prostate removed. We send patients, they meet with a pelvic floor physical therapist, or therapist, some are occupational therapist, once before surgery, and generally 4 to 6 visits after surgery, focusing on, the Kegel exercises, using the right muscles, breathing techniques. They also, with incontinence, pelvic pain, bowel dysfunction, or sexual dysfunction, or erectile dysfunction. We have our Kegel exercise pamphlet. It's pretty easy to read, understand, versus I think we used to give a book or something. We also have our cancer-related fatigue program and lymphedema therapy. Something that we initiated is a post-prostate removal care kit. I worked with a company, again, just looking for coupons or something for paying for incontinence supplies. So we are partnering with a company that's providing discounts to our patients and a sample kit for when they come in for their catheter removal appointment. So that's been well received. A lot of men ask, what should I buy? Where do I buy them? So this gives them a good idea. Genetics, so they help with understanding the hereditary or genetic risk for cancer. Especially if you have that high risk or family history, or you have children, a strong family history. And they meet with patients to go over their personal risk factors, family history, and then, of course, implications of genetic testing, and then next steps if there's a risk for cancer in the family. Research, open clinical trials by our research team for those patients who qualify. There is a list of open clinical trials on the website that you can visit, or there is a number there that you can reach the oncology nurse, research nurse, if you want to look at enrolling in a specific trial. Survivorship. Survivorship is life after treatment. So they help guide patients once they've been treated. It's also assesses their overall wellness, support for wellness, even if the cancer is not curable. A lot of patients, you mentioned survivorship and, I'm still getting treatment, or maybe they've had radiation, but they're still on hormone therapy for, another year. They can help support patients through, even through additional treatment. So they meet with a nurse practitioner after they complete treatment. So after surgery, radiation, during the appointment, they'll go over diagnosis information, recommended follow-up, recommended appointments and scans, maybe side effects that may come later or that they're currently having, preventative care and recommendations. So maybe the patient is due for another colonoscopy or other cancer screening, then they would help assist with that as well. The patients get a document that they can take. So it's an individualized care plan, but it outlines, the cancer diagnosis, the treatment. So pathology from biopsy, pathology from if they had surgery or their radiation course. So it's nice that they have that document. If they move or go somewhere else, they'll always have that document that they can take with them to, a new doctor if they establish somewhere else. We also have a survivorship nurse navigator that helps with scheduling, following up, and supporting patients through survivorship. We have a lot of programs that we put on. We have a survivorship wellness series, so that's usually they do 4 a year, I believe. But topics like fear of reoccurrence, cancer fatigue, where they might have a guest speaker with physical therapy or occupational therapy. They've done things with our dietitians or different speakers in the community. We also have Living Forward. We've had a couple years. So June is Survivors Month, and we have a day of celebration with some of our survivors with a meal and different activities. Palliative care. So supportive care that can improve patients and their loved ones' quality of life. They focus on relieving symptoms from treatment, maybe pain, nausea, fatigue, depression, stress. They work collaboratively with the provider, maybe with adjusting pain medication regimens, those types of things. Really, it's for any age and stage of cancer, even if it's curative. With cancer comes a lot of stress, and they can help with talking and getting patients through. Palliative care providers and then the nurses, they work alongside, like I said, the treatment team to help understand what's most important to the patient. Maybe there's something specific in their cancer journey that they absolutely do not want. Some patients, they absolutely do not want chemo. They absolutely do not want radiation. So just to help make those decisions and what's best for the patient. We also have the palliative care nurse navigator as well. In summary, with any cancer treatment, it truly takes a village. I always tell patients, even if you need someone to talk to, call and talk to me. It's what I'm here for, getting you to the right supportive services or resources. But you're never alone in your cancer journey. Don't be afraid to ask for help. That's what we're here for, and that's what the supportive services are here for. Yeah, you're never alone. There's several supportive services that are available to patients. All right. That is all I have.